Good morning, ladies and gentlemen. Welcome to Kinfon Dermatology Classroom. Over the next 40 minutes, I would like to go through what is new in the pathogenesis of atopic dermatitis. We know that atopic dermatitis is a condition with many phases of presentation. A patient with atopic dermatitis, they might walk into your clinic with acute eczema, subacute eczema, and chronic eczema. Acute on chronic, subacute on chronic, acute over the face, subacute over abdomen, and lichenified over the lower limbs. Acute plus bacterial infection, subacute plus fungal infection, eczema herpeticum. So what is the underlying mathematics for such a complex disease? This is what I'm going to go through in this lecture. Firstly, what is the mathematics, followed by 3 stories about atopic dermatitis, which are the itchy story, immune dysregulated story, and the skin barrier defect story. Without further delay, let's take a look at what is the mathematics of atopic dermatitis. A lot of parents, they have a very simple concept about atopic dermatitis. They think that atopic dermatitis or AD is equal to allergic dermatitis. Means that atopic eczema or dermatitis is due to interaction between allergen with allergens. The allergen here, often they will blame the food allergens. Of course, there are other allergens including contact allergen, to nickels, to preservative, and as well as aeroallergen, which can be further subdivided into indoor and outdoor aeroallergen. But we know very well that atopic eczema is not equal to allergic eczema because irritants also play a role in the pathogenesis of atopic eczema. The irritants here includes the environmental irritants from the chemical harsh cleanser, the physical irritants from friction with the clothing, scratching, as well as emotional irritants due to fluctuating emotion and stressful life. As we are well aware that 70% of the patients with atopic eczema, they have background history of family history of atopic disease, which suggests genetic composition does predispose a patient to hypersensitive reaction to irritants and allergens. Not to forget the Staph aureus or microbial dysbiosis. You take a swab over the eczematous area, almost always you'll be able to grow some density of Staph aureus. In fact, studies have shown that if you allow the disease to go beyond certain point, the autoallergy or autoimmunity will start to establish. This is the model postulated by Professor Thomas Beeble. According to this model, in the early stage of atopic eczema, most of them have negative IgE. So over the years of exposure to environmental allergens, the patients start to develop IgE against environmental irritants and allergens. Over time, if you can't arrest the progression and you allow the atopic eczema to evolve into chronic stage, about 25% of them will develop autoantibody against their own epidermal protein as well as the endothelial proteins. And at this point of time, the atopic eczema already on their auto gear. Means that they are already self-sufficient, they don't need much environmental irritants and allergens to stimulate the disease, and they are self-filling the disease. For those of you seeing patient, this is one of the cartoons that you can use to share with the patient what is the mathematics of atopic eczema. Atopic eczema, the 2 key endogenous risk factors are a group of genes that encode a defective immune dysregulation, another group of genes that encode the defective skin barrier. And these 2 groups of genes predispose the patient to atopic eczema. But having these 2 groups of genes alone does not explain atopic eczema, because atopic eczema is a condition that due to dynamic interaction between gene and environmental factors, which I already highlighted just now, which include the irritants, allergen, and microbial dysbiosis. For those of you interested to know more about the mathematics and the tree story, please go to www.pediatricdermatology.com.my to get more information about these titles. Thank you very much.